Okay, hi, I'm Bob Weir, and my guest today is Denton County Judge Andy Eads. Thanks, Judge, for taking the time to do this remote interview during the COVID-19 pandemic.
You bet, Bob. It's always a pleasure to speak to you, and I always enjoy our visits over the many years. And it's not the same if that we're not at your dining room table, but I'm glad we could at least do this remotely. So anyway, thanks for the opportunity, and telling that I said hi.
Okay, and same to Ginger. All right, the question on the minds of all residents is what are the guidelines for dealing with the resumption of day-to-day activities?
Sure, that's a great topic, and we're filming this morning on Friday morning at 11:30. We're eagerly waiting to see what Governor Abbott's going to announce here at 12 o'clock. Last week, I was working the phones. I was actually, Bob, walking in our neighborhood, getting a little bit of exercise, doing social distancing, and the governor called me on my cell phone. And we talked about the Denton State Supported Living Center, and we talked about steps that we need to take here locally to get Denton County back open. If you'll recall, that the Commissioner's Court I did it first under executive order, and then the Commissioner's Court ratified that a closing of the non-essential businesses at the beginning. The governor came back and closed the state non-essential businesses all the way to the end of April. And so I asked him about that, and I said, Governor, the North Central Texas County judges are working collaboratively on how do we reopen North Central Texas, each one of our counties, and hopefully we could do that in a collaborative process where it's very uniform for all of our citizens. We know that so many of our businesses have multiple locations across our county lines. And so I said, we're working diligently right now to set up some plans. He said, well, that's good, and I appreciate that. He goes, so this was last Friday, so a week ago today, and he said, I'm going to be making an announcement next week about that very exact same topic, so how we can, from a statewide perspective, address this. So it's a long answer for a short question, which is we're waiting to see. I don't know if the governor is going to outline for the whole state of Texas, all of our 254 counties. We don't know if he's going to bracket it like the rural counties, the smaller counties versus the urbanized counties. Denton County is the 9th largest county by population in the state. So we're eagerly waiting to see what he says today. I will tell you that the DFW judges, we were on a call yesterday. We were looking at, from a medical standpoint, for medical professionals here in North Texas, we were looking at a variety of metrics, like which businesses you would open up over a multi-phase process over about 5 different phases. That was in the morning. In the afternoon, we had a conference call with CEOs and government officials across North Texas and the North Texas Commission. Many of you may know that the North Texas Commission is kind of like a chamber of commerce for all of DFW area. They have a lot of major employers, major industries represented. In that conference call, I was on, as well as Judge Whitley from Tarrant County. We expressed our desire to hear from the industries. There's different segments of industries across North Texas. So we're asking them to provide to us their best practices for social distancing that they could adopt. So the restaurant industries, the wholesalers, the warehouses, the retailers, the salons. So what best practices could they adopt internally that they believe that their industry could implement? Then we get those in, and we have time to review those and hopefully work out a regional plan across North Texas for effective May 1st.
So, Judge, how many in the county, do you know how many have been afflicted with the virus?
Yes. So we've had today, this was yesterday's numbers, and so it changes every day, obviously. So we've had 564 total cases in the county, Bob. And currently we have 335 active cases. The good news is we've had 214 recover. So how do we know that they recover? We have a wonderful team of medical professionals up at our Denton County Health Department. and they stay in constant communication with our cases and with those individuals and check on them and make sure they're doing well. They provide updates to us, and so we record that. So we have 214 recovered. Sadly, we've had 15 deaths here in the county. So we've had 15 deaths. So this is a deadly disease. A lot of people don't really, they think a lot of this is overblown. I will tell you, this is a very deadly disease. One of the things that we're working on now is that we have adequate testing. If you saw the president's comments yesterday, he talked about the criteria for reopening America was that there's local testing being performed. And that's been a big topic for lots of folks, and it's a good topic. I will say that we've had lots of testing performed. Testing has continued since the beginning of this crisis. Do we need more testing? Absolutely. But Bob, we had a really, and this was one of the questions, and I just want to tell the public thank you for being patient with us. There was a lot of questions on Facebook and other social media and just emails to us that said, what is the number of tests? We hear the positive number of cases, Andy, but what are the total number of tests? We couldn't give you an answer because we didn't have the answer. So not all of those, all the individual doctors or the emergency rooms, the hospitals reported those to us. There's a lot of just individual doctors' offices that were testing people, but they were not required to report those. They were required to report the positive case, but not the total number of cases. So to include the negatives. The governor in his executive order 2 weeks ago required all the healthcare providers, it might have been actually 3 weeks ago, he required all the providers across the state to report those total number of cases to the state and also to the local county health department. So we did get those last Friday. So a week ago, we did get that total number. And Bob, we have 3,207 total cases have been performed in Denton County. What's great about that is of the 3,207, 880 of those were administered by the Denton County employees at the Denton County Health Department. So 880 of those, and so were conducted out of the 3,207. I just want to express our appreciation to our Denton County employees for being on the front line and answering the call to public service, first of all, but really exposing themselves to this, very deadly disease. And they did a great job. So if you look at the total number of cases that countywide, 3,207, and you calculate that into our population, that means that looking at all the 254 counties in the state of Texas, Denton County is number 2 in the rankings as far as testing the most per capita. So we're very pleased about that. We know that's probably subject to change. The only county better as far as the performance level as far as testing is Travis County down in Austin, where their county seat is.
Judge, how does a person go for testing? If somebody was concerned for some reason, maybe they suddenly had a fever, where would they go for testing?
Okay, so that's a great question. So they can call their, we really are asking for people to, we've been trying to test people who are symptomatic first, not asymptomatic, just based on exposure. But if they have symptoms, the shortness of breath, fever, etc. So they can go. The first plan is we ask them to contact their primary care physician and seek help there. If they do not have the test, or if they're not testing, some of them just are not testing. So if they're not testing, then they can go to a standalone critical care or an urgent care facility. So they can go to one of those locations. And lastly, they could go to the local emergency room. So that's the kind of the sequencing of where we're asking people to go first.
So, Judge, let me ask you this. What does the hierarchy look like? I mean, are county leaders waiting for directions from the governor, for example, before they give out any directions? Sure,
that's a great question. So by the Texas Local Government Code, your county judges, this goes back to the 1800s, the county judges are like the emergency management directors for each one of the counties. And so we have a lot of authority to implement local orders. And those authorities really last for 7 days until they're ratified by the commissioner's court. And so all of our actions that we've had to take have been subsequently ratified by the Denton County Commissioner's Court. So yes, there is a hierarchy. And so obviously the counties are submissive to the governor of the state of Texas. And so some issues we had to lead out on earlier, which the governor, because it fit our local jurisdiction. Some of the actions that were taken here in the DFW Metroplex would really not be applicable to some of the less urbanized areas of the state of Texas. And we realized that, so that's a local control issue. The governor did come in and do some statewide, the statewide closure, which we're currently under now. And he took some other efforts as far as restricting elective surgeries. And so that was something that he did. I would tell you, regardless of the hierarchy, I will tell you that the state of Texas has been very helpful. Our delegation here locally has been wonderful to deal with. Senator Nelson has been great, champion for us. State Representative Tam Parker, Representative Stuckey. These are some people that represent your viewership, your here at the Cross Timbers Gazette. We've been very well represented, and those individuals have taken my calls. We have been in constant communication, and they've been a great conduit for the needs that we have here at the county that they could express to the governor's office or the Texas Department of Health Services. So there obviously is a hierarchy, different levels of government. I'll tell you, communication has been very important. That's one of the reasons I wanted to be sure to accept your invitation, Bob, because I know communicating with the public is important to you as well. And we've had weekly calls with that I've hosted here at the county with our statewide delegation of our state elected officials, our over 40 mayors across the county, our superintendents, the different school districts across the county, and the leadership of our chambers of commerce. We realize our chambers of commerce and our business community needs to be at the table as decisions are being made. So we've had those every week. We also have a weekly meeting of the different county elected officials that are just the county organization, and our department heads. That's a separate meeting. But because we had to close so many of the services at the county, so how do we reopen, and how do we plan for that eventual day? And we hope it's very, very short. But I will tell you that the state of Texas has been very cooperative with us, and especially on the Denton State Supported Living Center up there. When we had that outbreak up there, that was very concerning to all of us, and Senator Nelson especially was able to help us with the different test kits.
And I think we're all impressed with the residents of the county that are going along with the guidelines and social distancing. I see a lot of people are wearing masks and being real careful that nobody's handshaking or anything like that, and we've been patronizing some of the restaurants in the area with the curbside pickup. I think that's important to try to keep them in business as much as possible. There aren't a whole lot of other places that you can frequent except supermarkets, and that of course has been happening pretty regularly. How about how are the schools adapting to the isolation? Are children being educated at home?
They are, and I like what I saw. Someone did a Facebook meme yesterday, and it said, and I'm keeping a lot of these. I screenshot them, keeping like I'm going to give them to our county museum, so they'll have it as they record this. It's very interesting. So many of the things that we're doing today were done 100 years ago, 102 years ago, in 1918 here in Denton County. If you go back and look at the archives, some things never change. And although this is a new disease, some of the same practices as far as social distancing and everything were happening back then. But as far as the schools go, I would tell you that the superintendents have done a great job of being very communicative. But the meme I saw, reminds me, the meme I saw was, it's funny. It said, "Who do you want to be quarantined with?" And someone said an 8th grade teacher, an 8th grade teacher, because they had 8th graders. That's who they wanted to be quarantined with. Yes, I'll tell you, the technology, especially that the Louisville Independent School District has been working on for many years, has really come into play with this social distancing and this homeschooling. You know, we have a senior at high school. He's been doing his classes online. So many of his are at North Central Texas Community College. He's doing dual credit. So he has not really experienced a disruption. It's kind of sad, though. He's a senior, and, you know, he very well may have been to his last day of school to LISD and never knew it. And so hopefully they'll get to have a graduation ceremony. Ginger's been, and I both have been quite upset about this. You know, the senior year has been kind of very different. And the class, our heart goes out to the whole class of 2020. I will tell you, Caroline, she's in 7th grade, and she's been taking her classes online through the school district and getting a little bit of help from us as well. But she's done great with it. I think a lot of other students have as well. What's interesting is if you look at the different, Bob, you were talking about how you and Annette have been patronizing the different restaurants, you know, through the new takeout services, you know, places we would traditionally go have a nice sit down evening meal, or we're doing takeout. I've been so impressed with so many of the businesses that have adapted their business model during this time. Caroline takes dance at Top Hat Dance Studio. Top Hat Dance Studio has been around for about 40 years. And I give a big shout out to Sharon Burris, and that's a local Denton County business. Has been around about 40 years, multi-generational, and they have adapted their dance classes to be online, and so they're taking tap, ballet, and jazz.
Really?
In her bedroom or in the garage. It's nice and cleaned out. The cleaned out garage, so she has plenty of room there. So they're even taking dance classes. And I was talking to her, the owner, Sharon, last night about something she called about, and I said, well, how are the classes going? And she said, they're doing great. She said, you know what, Andy, what's interesting is these parents are actually getting to watch their kids do the practices at home, because they don't really go into the studio as much. They kind of drop them off. So actually the parents are actually getting to be more involved and getting to see the progress of the students. So new and different times, new and different ways to continue our life here.
Amazing. Well, you know, something like this brings out the creativity in people they never realized that they had.
Yes.
I understand that the Flower Mound Chamber, they're doing remote meetings as well.
Yes.
I guess that's going pretty well. So that's good.
They are. So many chambers have been doing it. But yes, the Flower Mound Chamber's been doing it. And I think all of our chambers, when I talk to them every week and other times as well, they've been very innovative in ways to encourage their members to continue to do their business. And so I think shopping locally is the way to go and try to keep our Denton County businesses afloat. Well,
Judge Eads, I know you're awaiting the conference with the governor. And so I know you're very busy. I want to sincerely thank you for taking the time to address this issue with us. And, you know,
Bob, I would like to, Bob, before we hang up, I would like to address something, if you have just a couple minutes left on your time here. You know, a lot of people have asked me about, and I see it on Facebook and I see it other things, you know, we have the flu every year. You know, how does this relate to the flu? A lot of people ask me, how does this relate to the flu? Or they see the flu deaths in America, and then they're critical of the measures that have been taken here locally. I'll just explain it to you this way, and it's not my words, it's the words of our Denton County Health Director, Dr. Matt Richardson. I think he put it pretty well this week when he was explaining to the Commissioner's Court about the difference between COVID-19 and the traditional flu. So think about the flu that happens. In a 5-month, the most recent, this last year, just during the winter, the 5 months of the flu here in America, let's talk nationally, killed the same number that COVID has killed nationally in 5 weeks.
Oh, wow.
So in 5 weeks of COVID, now think about what's happened during the 5 weeks of COVID. Complete shutdown of American cities and American commerce and congregations and churches and mass transit and all these different things that have happened. In a complete shutdown, it has continued to kill at the same rate. I mean, not the same rate, much higher rate, but the same number. In 5 weeks with a United States shutdown, 5 weeks, what the flu killed nationally in 5 months. So when people say this is like the flu, they're wrong. It's not like the flu. It's much deadlier than the flu. And so, and if you think about the flu, it kills that many people, and you have all this population that's been immunized all these years. Okay, so and it kills that many. Think about the United States, who's never been exposed to this virus, and you have an unimmunized population. Okay, and we don't have a treatment for it. We don't have a treatment for it.
Right.
Or some treatments that are still very experimental. The flu has treatments. And so, you can go ahead and proceed with knowing through a flu season and use your personal judgment and your own risk factors and take that into consideration. But you do know that there is a variety of treatments for the flu. And we proceed through a flu season knowing because you can be immunized. You have an ability to be immunized. We don't have an ability to be immunized at this time. You don't have an ability to be immunized for COVID-19. So you have an unimmunized population. You don't have herd immunization, and so that herd immunity. And so that's what's a little bit different and very different, actually.
Oh yeah, very different. And that, like Dr. Fauci has said repeatedly, this disease is more contagious than anything they've ever experienced before. And that's why the shutdown, the isolation, and so forth. So we can only imagine how much worse it would have been if we didn't have the isolation.
Right. So I just think that's, you think about 5 months, 5 weeks, about the same kill factor, the fatality factor, and the fact that what it would have been like without it. I've been on the phone. A lot of people have been critical of the measures. I'll just tell you, I've been on the phone with the DFW Hospital Council every week or more as we listen to the epidemiologists and the hospital professionals. And so really what this was about, we're not removing the COVID-19 from the public. It will continue to be with us. We're not denying that, but this was about reducing the number of cases at the hospital in a very confined time period. We were hoping to spread that surge out. And I want to give great kudos to the people here in Denton County and the people of North Texas for kudos. They have done a great job on the social distancing. They have done a great job. Great job. We reduced we have flattened the curve. So people goes, where's all the cases? The cases are lower because we did the social distancing. If we didn't do the social distancing, we may look like New Orleans or Detroit or New York.
Sure.
Look at what's going on in New Orleans, right? Just our neighbors. They're a less densely populated area, and look at what they're dealing with. And so that could have been Dallas and Fort Worth, if not for some of these measures.
Well, all right. I want to thank you for taking this time.
Thank you, Bob.
I know you're very busy. I'm sure we'll all be praying for the end of this as soon as possible.
Yes. And Bob, let's just make a commitment. We will, when I'll get back in touch with you, or you call me, and we'll continue this dialogue as far as when we roll out this plan, when we get it established. Let's see what the governor says today. We'll figure out how this impacts North Texas and Denton County, and then we'll get together again. We'll have this conversation and really explain to people what we're looking at here. So I think it's important for us just kind of a thoughtful dialogue about the measures and how do we get out of this.
Well, thank you. I look forward to that. We will be doing that. Thanks again, Judge. I appreciate you.
All right. Thanks so much. I appreciate you. Bye-bye.
Bye.